285 Aphorism Organon of Medicine, 5th edition. The diminution of the dose essential for homeopathic use will also be promoted by diminishing its volume so that it instead of a drop of medicinal dilution we take but quite a small part of such a drop for a dose. The object of diminishing the effect still further will be very effectually attained, and that this will be the case may be readily conceived for this season, because with the smaller volume of the dose but few nerves of the living organism can be touched, whereby the power of the medicine is certainly also communicated to the whole organism, but it is a weaker power. Footnote: for this purpose it is most convenient to employ fine sugar globules of the size of poppy seeds, one of which imbibed with the medicine and put into the dispensing vehicle constitutes a medicinal dose, which contains about 300 part of a drop. For 300 such small globules will be adequately moistened by 1 drop of alcohol. The dose is vastly diminished by laying one such globule alone upon the tongue and giving nothing to drink. If it be necessary in the case of very sensitive patient to employ the smallest possible dose and to bring about the most rapid result, one single olfaction merely will suffice. Aphorism 285 is entirely omitted in the 6th edition and replaced by a new aphorism as follows. In this way, the cure of very old diseases may be furthered by the physician applying externally, rubbing it in the back, arms, extremities, the same medicine he gives internally and which showed itself curatively. In doing so, he must avoid parts subject to pain or spasm or skin eruption. Footnote: from this fact may be explained those marvelous cures, however infrequent, where chronic deformed patients, whose skin nevertheless was sound and clean, were cured quickly and permanently after a few baths, whose medicinal constituents by chance were homeopathically related. On the other hand, the mineral baths very often brought on increased injury with patients whose eruptions on the skin were suppressed. After a brief period of well-being, the lye principle allowed the inner uncured malady to appear elsewhere more important for life and health. At times instead the ocular nerve would become paralyzed and produce amaurosis. Sometimes the crystalline lens would become clouded, hearing lost, mania or suffocating asthma would follow, or an apoplexy would end the sufferings of the deluded patient. A fundamental principle of the homeopathic physician which distinguishes him from every physician of all older schools is this, that he never employs for any patient a medicine whose effects on the healthy human has not previously been carefully proven, and thus make known to him to prescribe for the sick on mere conjecture of some possible usefulness for some similar disease, or from hearsay that a remedy has helped in such and such a disease. Such conscienceless venture the philanthropic homeopathist will leave to the allopath. A genuine physician and a practitioner of our art will therefore never send the sick to any of the numerous mineral baths, because almost all are unknown so far as their accurate positive effects on the healthy human organism is concerned, and when misused must be counted among the most violent and dangerous drugs. In this way, out of 1,000 sent to the most celebrated of these baths by ignorant physicians, allopathically uncured and blindly sent, there perhaps one or two are cured by chance, more often return only apparently cured, and the miracle is proclaimed aloud. Hundreds meanwhile sneak quietly awake, more or less averse, and the rest remain to prepare themselves for their eternal resting place, a fact that is verified by the presence of numerous well filled graveyards surrounding the most celebrated of these paths. A true homeopathic physician, one who never acts without correct fundamental principles, never gambles with the life of the sick entrusted to him, as in a lottery where the winner is in the ratio of 1 to 500 or 1000 blanks here consisting of aggravation or deaths, will never expose any one of his patients to such degree or danger and send him for good luck to mineral bath, and as is done so frequently by allopath in order to get rid of the sick in an acceptable manner spoiled by him or others.